Now we will be talking about the loop diuretics. So the drugs in loop diuretics include furosemide, bumetanide, torsemide, and ethacronic acid. You're going to remember the names of these drugs. Now, they are high ceiling diuretics. What does it mean? It means that they are highly efficacious. They are highly efficacious in preventing the reabsorption of sodium. If you're going to increase the dose, their efficacious effect will increase, alright, and they're going to prevent the reabsorption of sodium, so thus enhancing the diuresis property. Here you can see is a structure of nephron, which is a functional unit of kidney. This is the glomerular filtrate where filtration takes place. This is the proximal loop of Henle, distal, and collecting ducts. Now, the main site of action of loop diuretics in all these portions is the ascending loop of Henle, right? So the loop diuretics act on the ascending loop of Henle. Now what happened in ascending loop of Henle? There are co-transporter, the sodium, potassium, and 2-chlorine co-transporter. They are used to reabsorb the sodium, potassium, and chlorine. Likewise, they are also used to absorb magnesium and calcium. Means the magnesium and calcium are also reabsorbed in this site. This site is impermeable to water. What does it mean? If a site is impermeable to water, means the tubule will have water there. So if there is more water, the environment will be hypotonic, right? Now, this descending loop of Henle is highly permeable to water, means the water from this side will highly reabsorb. So if the water is reabsorbed in the interstitial cells, the area that remain over here would be hypertonic because sodium and urea can't absorb from this side. But today's our main topic of discussion in loop diuretics will be the ascending loop of Henle, right? Okay, so normally as I discussed what happened, the sodium, potassium, and 2-chlorines are reabsorbed. Magnesium and calcium are also reabsorbed at this site, right? Okay, now if you're going to give these drugs, furosemide, bumetanide, torsemide, and ethacronic acid, they are used to block these transporters. So if these transporters are blocked, what will happen? There will be no reabsorption of these ions, and these all ions will be excreted in the urine. So here you can see the main point over here is calcium. The calcium can also be excreted in the urine in loop diuretics. So here you can see they are used to treat hypercalcemia, which means whenever there is high calcium level in the blood and we are going to give the patient loop diuretics, so they are going to cure the hypercalcemia. Okay, if we look at over here, they also excrete sodium, right? So if sodium is excreted along with water, the sodium causes hypertension, so they are used to prevent hypertension. Moreover, if the volume means water is also excreted, hypertension can also be caused because of blood vessel constriction, or you may see if there is more volume, right? It depends on the cases. So if there is more excretion of water, they're going to prevent the hypertension. Okay, now in loop diuretics, there is mostly the water is excreted in the urine, means the loop diuretics have high diuretic property and they are highly used to remove water from the body. So in oedema, in which there is a retention of water in the interstitial space, They are used to treat all kind of edema, or you may say edema, right? So cardiac, hepatic, acute pulmonary and renal edema, for all these diseases loop diuretics are given, because the loop diuretics are they are highly efficacious, and they're the most diuretics used to lose the water from the body. Okay, now what are its adverse drug reaction? In adverse drug reaction, they may cause electrolyte disturbances. Now in electrolyte disturbances, it may be hypokalemia. Why hypokalemia? Because in loop diuretics there is loss of potassium. Okay, now one more thing over here I'm going to discuss. The sodium, potassium and 2-chlorine transporter, they went from this side, come to this portion. What happens over here, in the distal portion the sodium concentration is higher, so the sodium is actively reabsorbed, right? Actively reabsorbed, and potassium in turn is excreted. The sodium is reabsorbed and potassium is excreted. It leads to hypokalemia, means potassium loss is over there. So in electrolyte disturbance there is hypokalemia, which can cause fatigue, muscular weakness and cardiac arrhythmia, because potassium is essential for cardiac rhythm. Now hypokalemia can be prevented by using a combination of loop diuretics with potassium sparing diuretics, because in potassium sparing diuretics there is retention of potassium. Or you can also treat it by potassium supplementation, right? You're going to give potassium supplements with the loop diuretics, then this can be prevented. Now they also cause hyponatremia, means they cause depletion of sodium from the kidney. They also cause hypocalcemia, as I discussed, and hypomagnesemia, because there is increased urine excretion of calcium and magnesium. And one more thing is that hypomagnesemia can also predispose to arrhythmia, because magnesium is also responsible to have rhythmicity in heart, right? Now in metabolic disturbances, we have it may cause hyperglycemia, means increased glucose level in the blood. Why it happens? Because there is decreased insulin excretion. The loop diuretics also causes hyperuricemia, because the drug decreases the renal excretion of uric acid. So if there is decreased renal excretion of uric acid, they may precipitate attack of gout. So gout can be the result of loop diuretics. Okay, now they can also cause hyperlipidemia, means they increase plasma triglycerides and low density lipopolysaccharide cholesterol level. Okay, the other thing is that it causes ototoxicity. The important point to note over here is you have to keep it in mind. The ototoxicity is also caused by aminoglycosides that we discussed in our previous video, and the ototoxicity is also caused by loop diuretics. Okay, lastly, they also causes hypersensitivity reactions. So this was all about the loop diuretics. We are going to discuss one by one in our next videos, inshallah. Allah Hafiz for now.